Prepare equipment, including goggles.
Proceed with the goggles.
Wash hands. Oxygenate client before suctioning, and then remove oxygen immediately preceding procedure. Pour sterile saline into basin and apply goggles. Apply sterile glove onto your dominant hand.
I don't know why I zoomed in on that. 'Cause it-
We're golden. Attach catheter to suction device. So your non-dominant hand's going to do that. Then grab the other end of the catheter with your non-dominant hand. Okay, now go over, grab the package with your non-dominant. You can grab inside the package with your dominant, the wrapper inside the package. Okay, there you go. Attach that end on there. Alright, moisten catheter tip with sterile saline. Quickly but gently insert catheter with dominant thumb and forefinger until meeting resistance, then pull back 1 centimeter. Okay. Apply intermittent suction by placing and releasing thumb over vent of catheter. Slowly withdraw catheter while rotating it back and forth between dominant thumb and forefinger. Encourage patient to cough. Rinse catheter is needed to clear secretions. Okay, I'm going to repeat it once more, but hold on the suction longer. Just slide your hand down it. Okay. Be resistant, pull back. Okay, good. Now withdraw and just hold the suction on a little bit longer. Okay. Clear the secretions once more, and then roll the catheter around your fingers of your dominant hand. So slide down to the end and roll it around. Yep, good. Disconnect. Take off your glove. Start bagging again.
Takes BSI precautions. Selects and attaches suction tip to suction tubing. Measures suction tip from corner of mouth to tip of earlobe. Marks maximum insertion length between thumb and index finger. Operates suction unit. Verifies suction is present.
Turn it on.
Opens patient's mouth using cross finger technique. Pinches suction to occlude suction. Inserts tip into patient's airway. Releases pinch to generate suction. Moves tip across pharynx into cheek maximum 15 seconds. Removes tip while maintaining suction. Verbalize flushing tip and tubing with water. Tip to suction tubing. Measures suction tip from tip of nose to tip of earlobe. Marks maximum insertion length between thumb and index finger. Operates suction unit, verifying suction is present. Examines both nostrils and selects the one which is largest and is not deviated or deformed. Pinches suction tip or assures whistle port tip open to prevent suction from being activated prior to insertion. Lubricates the end of the catheter and inserts into the selected nostril. If unable to insert, remove and attempt in the other nostril. When the catheter,
Keep your finger off of it, Sam, so you get stuck.
When the catheter
Turn your
has-
hand a little bit so I can see the port. There you go.
When the catheter has been inserted
That's fine.
to the predetermined depth, cover the whistle stop opening to activate suction. Suction for 15 seconds. Removes tip from Removes tip while maintaining suction. Verbalizes flushing tip and tubing with water. Selects and attaches suction tip to suction tubing. Operates suction unit. Verifies suction is present. Opens patient's mouth using cross finger technique. Inserts tip so curve of tip matches curve of airway. Leaves control port open. Verbalizes tip must not be inserted beyond the back tongue. Covers control port to generate suction. Moves tip across pharynx into cheek maximum of 15 seconds. Removes tip while maintaining suctioning. Verbalizes flushing tip and tubing with water. To evacuate air before inserting tip into patient's airway. Slowly releases bulb to generate suction while removing tip of syringe from patient's mouth or nose. Empties the content of bulb syringe into appropriate container. Repeats on both mouth and nostrils.